evening, viewers. Welcome to yet another episode of Health and Lifestyle on AIDS TV. I am Dr. Victoria, and this is my colleague, Dr. Doreen. Once again, you're all welcome. Today, we are going to be talking about a topic that, frankly, as ENTs, it is one of the most bothersome to manage in patients because it could be so many things. We will tackle the most common cause of a lump in the throat, and then we shall talk about what you can do at home when you have a lump or feeling like you have a lump in a throat, and when to come to hospital, just like we've done for the other talks. So for a start, many times, Dr. Doreen, patients will come in and say, I have a lump in the throat. And some can't even describe what they're feeling, but they just say, I have discomfort in the throat. What are those other ways in which this lump in the throat can present? What other symptoms may a patient have? That the commonest is they'll tell you there's a lump, but some will tell you something else.
Good evening, everyone, and welcome back to the program. The lump in the throat thing. I think we see it a lot, but it has been even worse during the COVID period for several different reasons. And what do we mean by a lump in the throat, if I can go back a little bit? Some people will definitely tell you there's something here. It's just here and it's not going away. I will swallow my food, I breathe just fine, but I feel like there's something sitting here. Other people do not have that overt thing that is sitting here. Some people talk about there's something that keeps cutting me, and they'll tend to point here. Like I swallow and I feel like something cut me, then it moved here, then sometimes it goes away. So it's really on and off symptoms. You asked about presentation. Presentation, other than people walking in and saying there's something in my throat and I think it's cancer. It's the commonest thing that they will say. Or alternatively, with my report on
That just amuses me.
It's almost like it feels like I'm angry, like you want the thing, I'm going to cry, I'm going to scream, but that's the sensation you have, and it may be on and off. Sometimes it's on, sometimes it's off. The other ways it may present is, like we've said, migratory pain. So you have this pain that keeps alternating. You may have most people will associate it with something in the past. I was drinking Busher and I think I drank a piece of metal in there, or a stick, or polythene, or I ate grasshoppers, yes, or I swallowed a tablet and I think it stayed here and never went away. But before we even look at the presentations, other than that typical, there's something wrong in my throat, or my throat feels dry and like it's scorched and there's something, then I drink water and it won't go away. I think we need to first understand the possible causes before we know the possible presentation, because the causes tend to determine the presentation.
Thank you very much. So, talking about the causes, I think we're going to tackle them one by one. One of the commonest causes we have is infection. And infection can be bacterial, it can be fungal, it can be viral. We all had COVID. Many of us had COVID around December. We think we had Omicron. And the commonest presentation was, Doctor, there's something scratching my throat. So infections can give you that sensation. Among the fungal ones, the commonest is Candida. Among the bacterial ones, the commonest is something called H. pylori, and we shall talk about other symptoms that come along with it. But yes, infection is the commonest. Next cause.
The other one is what we call reflux, and for many patients who have come to see us, you look at your medical form and we have reflux pharyngitis, globus pharyngitis. That's what we write as a diagnosis. And typically this is the fact that acid from your stomach is rising up. Now, to step a little bit backwards, we all have acid in the stomach. It's necessary to have acid in the stomach. It's not a good thing if you don't have acid in your stomach, because that acid is necessary to help you digest your food. make it softer so that we can get all the nutrients from it. But in the event that either you have too much of it, you have a lot of pressure within your stomach. You know, people who eat and they say, I eat a little and my stomach is also full, or you eat too much, so the stomach is also full. We can have a little bit of the, I'm going to loosely say, acid bubbles come upwards. And this distance between where we swallow from, the beginning of your throat and your stomach, is not that long. It's maybe half a foot long, about 15 centimeters long. So in the event that there's any increased pressure in the stomach, the small tap that is supposed to protect us from anything coming up from the stomach will not work well, or the pressure will override the strength of that tap. So we have a little bit of acid coming up. And for a few patients, they'll come in with active heartburn, and for some of us, we don't feel any heartburn. So you're wondering how I'm talking about acid if it's supposed to burn, and I'm not feeling anything down here. So the other common cause is reflux, and sometimes we say active reflux, and sometimes we say silent reflux, where you don't feel the typical symptoms of a chat. Or
but it's actually there.
It's actually
Just
there.
because you can't feel it doesn't mean it's there. Yes, thank you, Dr. Doreen. The other cause that we may have, Dr. Doreen talked about that area between the stomach and what we call the esophagus, but really the tube where the food goes down to the stomach. There's a stopper there, or a tap, or like a valve, or a sphincter. And sometimes you have part of the stomach rolling up through a defect here, and it comes up, and so it gives you what we call a hernia. So when that rolls up, the sphincter is no longer held, and so things can easily just flow back. You no longer have a valve or a stopper, so things are going up and down easily. And it's made worse by the things that you talked about, having very heavy meals, so eating a lot, drinking a lot of water, because it flows up much more easily than solid food. But yes, that can be one of the causes. And then medications, Dr. Doreen.
Medications is really commonly the drugs that cause dryness. Things like antihypertensives, some of them, some diabetic drugs, you know, they're supposed to drain you out. It's worse if you're on a combination of the two, antihypertensives and anti-diabetic drugs. And then maybe some drugs we use in mental health. They do cause that sensation of dryness, and because of that dryness as a side effect of the drug, you will present such as someone with a sensation of a lump in the throat. And I'm curious, one of the other common things they talk about is allergies. What do you have to say about that as the allergist?
As the allergist, allergies cause inflammation. So you have this constant state of things are raw. It's like you always, I'm trying to find the easiest word for it, but you feel like there's always like an itchiness, the same way you feel it in your nose, your eyes, and people will keep doing sorry, you have that feeling like there's discomfort. And on top of that, allergies can cause a bit of dryness, and the medication for allergies can cause some dryness. So if someone has allergies and they're constantly on medication for allergies, they may not have the itching, but they'll feel the dryness in their nose and in their throat. So allergies is one of the other causes that when we are ruling out, we want to make sure that someone doesn't have other symptoms of allergies elsewhere, or they haven't had, like it didn't start as an itch and the need to constantly cough, because that is typically how the allergies would present. And then the last cause is what we fear the most, tumors.
Yeah.
And tumors can be cancerous and non-cancerous. And that's a whole different topic on its own. But because today we are trying to figure out whether it is cancer or not, we are going to talk about all these other causes, talk about the commonest causes, because many times someone will come and say, I have had this for 2 weeks. I think I have cancer. It's only been 2 weeks. In medicine, we have a saying, common things occur commonly. And so we'll first try and rule out all these other things, but we will run the tests for you to be assured that there is no cancer, because if you feel like we did not check for it, you're going to continue being anxious. You may become hypertensive. They'll put you on antihypertensive. The symptom will get worse. You see where we are going.
Yeah.
So we're going to try and tackle that.
Maybe before we leave the causes, one of the other things, and it's going to play a lot when we come to management at home, is lifestyle. Your lifestyle does play a big role in your health, and I guess this is why the program is called health and lifestyle. But people who take a lot of lemon, a lot of citrus, a lot, especially on an empty stomach, and this was worsened during the height of the pandemic, of the COVID pandemic. We had all sorts of concoctions. My own mother, I'll tell you, gave me her own concoctions, and we have this lemon with garlic and ginger and chili, and I took this one.
Lives in there.
Anything green can be blended or boiled, and we will drink it. But also there's some of us who are on maybe a weight loss span, or and we know it's healthy to take a glass of lemon water in the morning, but not every lifestyle measure is for each one of us. Not every trend is for each one of us. So for people who take vinegar, especially apple cider vinegar, sometimes for weight loss, sometimes for health benefits, we found lemon, lots of ginger and spice, or people who are prone to ulcer or gastritic pain. Those people are going to struggle a lot more with the acid reflux than the others. So lifestyle measures, if you have suddenly gained weight, it could also be an issue. For some people actually have found sudden loss, intense loss of weight will worsen a pre-existing condition. So some lifestyle measures are also part
Talking
of
about
causes.
the weight loss and the weight gain, I had a client who just got very confused because we were telling him to lose weight, but then he came in with another family member that we had told, you lost so much weight suddenly, and he was quite confused. When you gain a lot of weight in a very short time, much as the fat will go in your stomach, your cheeks, it also goes there in the throat. And so when you gain a lot of weight, you start to snore because that place has become narrowed, but also you're going to feel like there is something in your throat because it has become narrower than usual. When you lose a lot of weight quickly, you get redundant skin. Yes, same thing happens there. So it's about, that's why you're advised in many cases not to lose suddenly and not to get, if for those who want to gain, I don't know whether you'll be advised to gain weight unless you're really malnourished. But if you're losing weight, it has to be a gradual process to allow those areas to, adjust gradually. So anyway.
So we have talked about the several different causes, but really the key thing here was to look at, should I be worried? Could it be a tumor? And when we say tumor doesn't necessarily mean cancer. Tumor just means there's an abnormal growth somewhere, something I should be concerned about. We've said one of the common things as causes is infection and reflux.
Yes.
So what are some of the presentations for these patients that when they come in? Majority of the time when you come in and think it's cancer, most often you're going to come and say it's a reflux problem. So what are some of those key symptoms that people experience and tend to bring them in?
So we talked about the feeling of a lump in a throat. We've talked about dryness, and dryness is common. We talked about the drugs, but with reflux it's common because the acid comes up, burns and dries up that area, and so you feel dry. But what happens when you get dry is your body tries to produce mucus in the throat, and so some people will come and say, I have this thick mucus that just won't move, and then when I cough it out it's white, and I have to really cough and it's really stretchy and thicky. So that's another thing we get. The other thing we get is, they have the dryness, you have the irritation, so someone is constantly so in children, and the complaint will usually come from, say, a parent or a spouse, and they say, doctor, I can't, he's constantly clearing his throat. He could be having cancer. And I get this from wives, husbands, parents, and the concern is real because it's just, the noise is bothersome. Some people get a bitter taste in their throat from the acid, coming up. So it usually tastes like you've just thrown up, you've just vomited. So that
Bile.
bitterness. So yes, the taste of bile. Or some people come and say nimpura. Okay, no, sorry, we are in Ankole. I feel like I've just eaten a lemon, yet I did not eat a lemon. Then for some people, because the acid comes up, it doesn't just go in your throat where you swallow from, it also goes to the area where you have your voice box. And so your voice sounds a bit like this in the morning, and you have to clear it to get it out in the mornings, especially because reflux tends to happen at night when you lie down. You've taken away the gravity, so everything flows back up, and we shall look more about that. Then some people get a burning in their chest. So other people, like if you've gotten heartburn, you know what that feels like. But some people have never suffered from heartburn, and so you ask them, do you get heartburn? And they say no. But when you ask, do you get a sharp pain in the center of your chest, sometimes coming from down going up? Some people will tell you it actually feels like it's burning a trail upwards. For those of us who drink, say if you drink whiskey or spirits, that's the feeling that you get, but now with pain. So it's not the nice heat that goes down, it's heat that's coming up with pain that sometimes shoots to the back of your chest. And so those are some of, I don't know if I've forgotten anything. Yes, so we talked about H. pylori and the other symptoms that can come along with the H. pylori infection. So when you go down to the stomach, these are people who belch a lot, they are bloated, they have a lot of gas, they feel that burning sensation sometimes starts from in the stomach, or they have pain in the stomach. Some, especially just before they've eaten when they're really hungry, or some after a meal. Just after a meal, they'll feel that. And so those are some of the symptoms that can alert you to either reflux or infection or those non-cancerous presentations of a lump in the throat.
I mean to say we shouldn't take it lightly that a possible tumor couldn't cause some of these things, because if you did have something growing in your stomach, the belching, the excessive bloating,
and getting full
really early, it's a possibility. And later on towards the end, we are going to look at when should I be concerned, when should I go in and get extra help. But before we go there, I think we should really take away this reflux bit. And the H. pylori we must treat medically. There's nothing you need to do about that. It's an infection you probably acquired from food you ate. Maybe ate some raw salad somewhere, or some bit of unhygienic food, and you get a bug in your stomach. And this is the same bug that is responsible for development of peptic ulcers in some people. Now, if we go to I have reflux. Majority of the time, every patient is worried about this treatment. Doctors will always find a way to give me a pill. But I know that the key thing here that we try to do is, what can you do for yourself at home? What can you change to try and manage this? So what are some of those key things that, or lifestyle changes, like we say, what are some of those things that I can do at home if I'm presenting with some of these things? I have a dry throat, I get a cough in the night, I wake up, I want to drink some water in the middle of the night, I'm just not comfortable. What are some of the things? It's maybe 3-5 days or 2 weeks.
Yes, it's interesting. When we were starting, you talked about lifestyle changes, or lifestyle contributes a lot to this symptom. And so those things that we said will cause reflux are the things that you want to take away. So if you've just recently introduced acidic foods into your diet, and that includes lemon, garlic, oranges, pineapple, passion fruit in large quantities, you want to reduce them, or even if you can, stop them altogether for the period when you are going to be on medication. And these are the same things we'll ask you to avoid when you have H. pylori, because H. pylori increases acid production. So just because we are talking about reflux alone doesn't mean we've eliminated the H. pylori infection only. Yes, we'll give the antibiotics, but on top of that, there are extra things that you need to do. So we can avoid the acidic foods, the spicy foods, pepper, Indian food, no. My Indian friends. You may want to reduce on the quantities of the spice in the food. The other thing that you want to reduce on is coffee. For those of us who take coffee, some of us cannot function without a cup of coffee in the morning. If you are like that, then you want to take coffee but then hydrate. Take plenty of water because it dilutes the acid that has come up. And it's not about sitting down and drinking a whole jug of water at once. You're going to have constant sips of water throughout the day. So you're the type of person who's walking around with your big water bottle. The other thing you want to do is reduce on foods that have a lot of starch. These foods lead to the production of, so they require more time to digest. The longer food requires time to digest, the more likely you are to produce more acid in digestion of the food. So heavy foods that require heavy digestion, particularly starches in our diet, you want to reduce.
If I could chip in a little bit on that, I think you've really tackled the dietary bit. When she talks about starchy food, and this is something I have a discussion with patients when I see them, our diet is largely starch. And I mean, I'm going to have a bit of kalo with some sweet potatoes and matoke, cassava. I mean, all food and meat with genets. Isn't that what we usually order?
Yes.
Yes. So a lot of our diet is starch. And I mean, I'm not saying you can't eat anything. So most times you're going to say you can't cut out everything in your diet. I mean, you need to survive. You need to enjoy your food. Yes. So we say eat small but frequent meals. You don't have to have kalo with posho and sweet potatoes and cassava on the same plate. And also, if you're going to have your heavier meal, it should be earlier in the day because you're still active. The assumption is you're still active, you're still working, you're still walking, so you are actually aiding digestion. But when we tend towards end of day, towards supper, we want to make our meals lighter. There is a saying, eat like a king for breakfast, but eat like a pauper or a poor person for supper. So you want to keep your supper really, really light. So a little Irish, a little rice, salad, maybe a salad, but you also want to have it earlier in the evening so that you're not going to bed soon after. So that's why we say smaller meals rather than large meals. You like your heavy starch, it's earlier in the day. And being in the region we are in, I am going to say kashera. That is a problem. Kashera is actually high starch. So if you love the kashera, if you love whether it's chinyankore, whether it's hot with milk or without milk, it's best we have it earlier in the day. And when we start therapy, when we start these lifestyle changes, I usually say anything after 4 p.m. we don't take bushera. Because it's heavy starch and I know you're going to have something for dinner. So let's have it earlier in the day, but also for everything we drink, follow it with some water.
You talked about dinner, and we know your body starts to wind down towards the end of the day. For most times we'll advise our patients to have dinner at least 7:30. After that, your systems are really shutting down as they should. When the sun goes down, the hormonal changes in our bodies and our systems start to go to sleep slowly. So you want to try and have your meals earlier. But another thing is when you have dinner, don't go to bed immediately because we said you're going to lie down and everything is going to flow upwards. Give some time for your meal to get digested. So at least an hour and a half.
Can I lie in the chair and watch TV?
No, don't lie down immediately after having a meal. Whatever the meal may be, breakfast, lunch, supper, when you eat and lie down, things are going to flow upwards. When you eat as you drink, you make it easy because you're making the food liquid and it's going to flow up. So have your meal, give yourself at least 30 minutes, then drink. And when you drink, don't drink a whole jug. Take it in small sips, okay? Don't be in a hurry as you eat, because it's called mindful eating. When you eat very quickly, you're gulping a lot of air along with your food. And so I've seen people who have their meal very quickly and after that they sit back and then they belch. You do not want that to happen, especially when you're dealing with reflux, because those bubbles are going to come up with acid. So do mindful eating. Chew your food slowly, deliberately, and well, so that it is not heavy when it hits your stomach. It is digested quickly and goes through the system, but you're not taking in air. We see this when we are feeding children and they tell you, feed the child slowly. They're going to take in air and then they might vomit. It's the same with us adults. So be mindful as you're eating and eat slowly and deliberately. And you know what happens when you eat slowly and you have little time? You're eating smaller meals, which is good for you.
So other than diet, and we've talked a lot about the do's and the don'ts of the food, is there anything else that we would advise a patient with these symptoms?
So we've talked a lot about the don'ts, and some of the do's. The biggest do is drink plenty of water, hydrate, but also exercise. We said when you're active during the day, you're breaking down your food more. So exercise allows you to digest food better. 3, if you're overweight, it would be good to get on a weight loss regimen that does not include lemon and garlic and company. So exercising, intermittent fasting works, and also hydrating helps with losing weight. If you have suddenly lost a lot of weight, if it is a weight loss that is unhealthy, that is concerning, and you need to go and see your doctor. If it was not intentional. If it was intentional, then you can continue with all these other lifestyle changes, because we don't want you then again to gain the weight. It could have been for health reasons, okay? But as you're losing the weight, you can exercise to allow digestion to happen better. But also knowing that you're losing the weight can cause those symptoms. Sometimes it's about allaying your anxiety and not focusing on the symptom. And for some patients, it's ridiculous that when they know the things that are causing it, it miraculously goes away. We don't know how that happens, but it does. It's because you're not focusing on it, because now I know it's not this, it's not cancerous, I'm not going to die, I'm fine, I'm okay, and then you tend to relax a bit. There are things that, one of the don'ts was avoid fatty foods, oily foods also. But in the things that you can eat to improve on your neutralization of acid, managing digestion, fiber, so our greens, dodo, nakati, even cabbage is really good for reflux. What other fibers do we have? Things like whole grain cereals, oats.
I can't think of anything, but what comes to mind immediately is nuts and okra. Okra is it's a wonderful thing. There are those things we don't like: okra, cactus, aloe vera, because it just feels, it looks like mucus. I agree with you, but it improves the lining from the esophagus, from the throat all the way down your esophagus to the stomach. What we want that area to have is that mucus or mucin layer. So when it's there, especially for patients who have that burning sensation, it's very helpful because it allows a new layer along the digestive canal, so that whatever little bits of bubbles are coming up, at least they are not directly burning the skin of the esophagus, because that eventually, if persistent over time, could lead us into more dangerous things. So I have advised a few people, it's not the best testing thing when you're not used to it, but at least just try to have the same way you have a bottle of water. You can put some okra in there, just overnight. Cut 2 pods, put them in a bottle of water. It's not as bad at that time. And then you just keep sipping on it through the day. And I think it's been helpful.
Some people have added cucumber to the okra water.
Maybe it's helpful
and
for the taste.
It helps.
Maybe. You don't look very happy about it.
It does. I don't enjoy cucumber that much, but I'll eat it when it's healthy for me.
Yes. So some of the other things outside of diet, and a lot of it is based off of diet, is when you go to bed, you want to try and use a pillow. What we are aiming to do is, remember, stomach is down here, chest is up here. There's a very narrow band separating the two, which we call the diaphragm. You want to keep your chest a little higher, so that when you don't allow gravity, when you're lying flat, things will flow easily. When you put a little inclination or a little elevation, it's harder for things to go up. So the same thing Dr. Victoria was saying, don't eat and lie down. When you do lie down, especially if you feel that burning and the dry throat and the choking in the night, you want to try and elevate. So your chest is higher than your stomach.
Yeah, the people who do this very well are pregnant women. If you have had a baby, you know this too well. And so you'd be the best person to advise. Because you know those positions where you put the pillow and then you can get some sleep at night, because the baby pushes up. And that's one thing that we did not talk about. Pregnancy can cause a lot of reflux. And this goes away when the baby is born, really, because it's just pushing up on that area that we talked about. So using pillows, hydrating, it helps. But also lying on your left side helps, especially when you're pregnant. It helps a lot to when the stomach and the stopper. The stopper is on one side, that tube that goes up, and the stomach it curves over. When you lie down in such a way that the tube that goes up is higher up, everything sits in that bowl of the stomach, which is best achieved when you lie on your left and not on your right side. So even in a non-pregnant state, you can try it and see if it works, or lying on your tummy with the pillow has helped a few people.
Okay, but so outside of lifestyle, definitely there's going to be medication for some, not all, but there's likely going to be medication. And among the medications that we are likely going to give you are things like antacids. Antacids include something like magnesium trisilicate, you know, the magnamint you buy in the pharmacy, and that's supposed to help with that layering along your alimentary canal to stop feeling that burning. We may give you some drugs we call proton pump inhibitors, and this is reducing sensitivity of your stomach lining, if I should say, or your alimentary canal to the acids, like how much they take up the acid, just to put it simply. And then of course there are other drugs. There are people who have tried bicarbonate of soda to try and neutralize. Where there's acid, you want to put a base.
So that's baking soda.
Yes, baking soda.
Yes.
So that you try and neutralize the acid. However, I want to say, do not be anxious when you come in and we tell you this is going to be long-term treatment. We appreciate the fact that the drugs don't come innocently. Everything can have a side effect. And there is no therapy that is the same for everyone. You would wonder why you both have the same diagnosis and are giving her medication for 2 weeks while yours is 6 weeks. But the reason this treatment is long-term is we want to rest everything. We want to control that acid over a prolonged period of time. But it will never work without the lifestyle changes. And it's said you have to do something constantly for at least 3 weeks for it to become habit. So majority of the time, our treatment would go on for 6 to 8 weeks. In a few cases, even 12 weeks, depending on the cause. And then we are going to say in that period of time, you're practicing all these things we have talked about. and they're becoming habit, such that by the time we withdraw the medication, you
have
already
established the
have
habits.
something that you're working with.
So really you're treating yourself in so many ways. The medication is just reducing the acid load to give you a fresh start. So it's really not the cure. The only time we give you medication as a cure is when we are dealing with an infection. So for those who come in, we'll run tests for H. pylori if we suspect. So if we have the additional symptoms we talked about, and if it's there, we'll treat you. Those are the ones that get treated for at least 6 to 8 weeks.
Yes.
Many times. And we'll first treat the bacterial infection and continue with acid control as you establish these habits. And we give your stomach lining a fresh start.
Maybe just to wind up, if you do happen to come to Atlas, or those who have been to Atlas, you're going to find that many times we will give you a whole booklet.
Well, it's not a booklet. But some patients do look at it as a booklet. What we have talked about is it can be a bit much for a patient to take in one setting. And so if you go to your healthcare provider, sometimes they will write or sometimes they will not. It's always helpful for you to, if you can take notes or if they can note it down for you. We have taken the liberty at Atlas Audio and Medical to give you this. We have a list of do's and don'ts, but we will still discuss this with you as a patient so that at least you're able, when something is told to you, it's easier to remember than when it's on paper. And let's be honest, many times people will just keep it. But we will give it to you so that you have no excuse. You at least have a record of things that will be easy to remember when you just look at this form.
I'm going to emphasize there is no uniform therapy for everyone. Not every do and don't applies to everyone. So it's important to have a discussion many times so that you know what is relevant to you. And that brings me probably to the last bit of our talk. When should a patient be worried? When should they be in a rush? Or when should they set up an appointment to come in, either see an ENT or see a surgeon or see a physician about these symptoms?
Yes, I know that's what we've all been waiting for. So you should be worried, one, if your symptoms persist beyond 2 to 3 weeks. Because, and you've tried all the home remedies that we've talked about, because we could be dealing with an infection or we could be dealing with something more serious like cancer. 2, you should be worried when you have been given treatment and the symptoms are not changing. Keyword, changing for the better. We've had patients who will take medication for 4 weeks and they feel like the symptoms are still there and they come back and say this is not helping. And you know what happens? They'll go and find another clinician and then another and then another. It takes a bit of time for the damage that has been caused by acid to start to go down. So give it at least 6 weeks. And in those 6 weeks, if there is no positive change, then you should go and see your doctor. If there is a positive change, then there is something that is working, and maybe now we need to modify our lifestyle to see if we can get more of a positive change or get to where we want to get. But that said, if you're ever worried, and we say this each talk show, if for any reason you feel something is seriously not right, you're best still seeing your doctor. The other thing that we talked about with regards to H. pylori was the abdominal symptoms, because H. pylori is not going to go away with the home remedies. So belching, abdominal pain, gripping in your stomach, bloating, you should go and see your health worker. Or if you feel a bit nauseous, some people have had fevers. If you notice a sudden weight loss, if the symptoms come with ear pain, and many times it will be on one side and persistent, And if you feel like you're unable to progressively, like over time, your swallowing is getting worse, like things don't pass. So initially you could swallow solids, then you can't, then now even the liquids are not going well, you should seriously see your doctor. I don't know if we've forgotten anything.
Maybe if you get difficulty in breathing,
Oh, yes.
or every time you try to swallow you're choking on everything you're swallowing, there is need to be concerned. I think you've summarized them well. Whatever it is you've tried at home, or symptoms have been persistent or worsening over 2 to 3 weeks, you have that constant feeling there's something seated there, especially if it's in one place and not changing positions. That's concerning. You've talked about the weight loss. You've talked about the additional abdominal symptoms, nausea, vomiting, abdominal swelling, constipation, diarrhea.
Yes.
You've also talked about fevers. In truth, you are concerned, you should check in with your physician. It's always the best thing. You rather go in and be told there is nothing than if you come in and we say you should have come in 2 weeks ago. So other than that, when they come in, anything expected of them? If you do happen to see an ENT, because you could see so many different kinds of doctors for the same thing.
So it depends on what cause is arrived at. Many times, just by having a conversation with your ENT, you'll tell them, I have this lump in the throat, but then I also have a lot of gas. The first thing we're thinking about is H. pylori or infection. So I'll ask you to run some tests to determine whether you have H. pylori. And their blood tests, their stool tests, will leave that to your doctor to interpret them. The other test we may do is an endoscopy. And there's several kinds of endoscopies. For starters, ours would be what we call a laryngopharyngoscopy, and it starts from the nose. It stops just about there above your voice box. It's not the one that goes all the way to the stomach. The one that goes all the way to the stomach is upper GI endoscopy, that is done by another specialist. When we do the endoscopy, what are we looking for? One, we are trying to determine if there is any abnormal growth. But two, if we suspect that there is nothing cancerous growing, you would ask yourself, then why go ahead and do it?
Yeah.
Some patients will come in and they're very anxious that even if we explain and say, look here, I do not think, I have no reason to think that there is anything, we still have to do the endoscopy, mostly for the patient to allay anxiety. But there have also been times when something that looks innocent, symptoms appear to be not even pointing towards cancer, but they've lasted for quite some time. So anything beyond 3 weeks, we have to make sure that there is nothing abnormal growing. That said, when we do an endoscopy, we are able to diagnose some infections, like the fungal infection. So if you have candida in the throat, we are able to tell whether there are features suggestive of heartburn or reflux. We are able to tell you if there is any abnormal growth in the spaces that we can see. And we are also able to tell you if your muscles are moving abnormally, which is another variety. It's rare, but it's called globus hystericus, hysteria. It's just the muscles are moving abnormally, and so you feel like sometimes they clamp down, other times they're relaxed. So those are the 3 things that we can look for as ENTs. The other things that extend downwards would be done by the gastroenterologist who does the upper GI endoscopy. The other test that we may ask for is we can take a throat swab, the back of your throat, not for COVID, but for other things. Sometimes you'll see fungus, sometimes it's not that obvious. Or sometimes you have what we call atypical bacteria that we not normally see in these parts, but they may cause symptoms. So, for example, people who practice oral sex and they have bacteria that you'd normally find in your genitalia, but it is found in the throat. It's not the first thing I'm going to think about treating because it's not bacteria that is common here. But if someone comes and we have treated everything and it's not going away and we don't have a reason to believe that there is cancer, then we may be pushed to do a throat swab and make sure that we're not dealing with something that is atypical in the throat.
Wow, so much said, so much learned. So, as a wrap-up, what would be the takeaway for any patient who feels a lump in the throat?
Any patient that feels a lump in the throat, the first thing we need to think about is our lifestyle.
Lifestyle.
Lifestyle plays a very big role.
So modify lifestyle, either in the positive or remove some things.
Yes.
Okay, that's wonderful. I guess my takeaway is a lump in the throat, it can be an obvious thing, it may not be an obvious thing, but the management is going to differ, and it depends on how much information you truly give your physician. It could be an ENT, it could be a physician, it could be a surgeon. But we always need to remember the key things when we should be worried and we should go in and see a doctor.
It's not always cancer.
It's not always cancer. It could be many other things that can be cancer.
It's not, don't always think first cancer.
I guess we may
Common
have to
things
plan
that
for talk
happen.
one time on cancer of the throat as
yes.
a specific thing. Otherwise, thank you so much for today. It's been wonderful.
Thank you very much, our viewers. Once again, we're very honored to have you this evening. We'll ask you to keep tuned in. We are going to be having a series on hearing health, hearing loss, what it is, what it is, what causes it, how do we assess for it, what can be done, is it a curse, what are the myths around it, and what services are available to you. So please stay tuned and just look out for that talk. It's coming.
Thank you very much and good evening.